Hi, everybody. I am Dr. Sofia Noori. I am a psychiatrist and also the CEO and co-founder at Nema Health, which is a clinic that focuses on trauma and PTSD. I think what people don't realize, there's actually a few first-line treatments for PTSD, of which EMDR is just one. I love EMDR. EMDR stands for eye movement desensitization and reprocessing. It's a great possible treatment for PTSD for folks who are looking for trauma therapy. EMDR requires folks to re-immerse themselves back in their trauma and helps them essentially desensitize themselves to their trauma. But also sometimes people don't necessarily want to re-immerse themselves in their trauma in order to heal. And so another therapy that I think is a really great option for those folks is called cognitive processing therapy. I really like the name they use in Africa. There they call it heart and mind therapy. And I feel that is such a great description of what cognitive processing therapy is. For folks with trauma, they're either numb or totally overwhelmed. And so the first thing that we do in heart and mind therapy or CPT is to understand what are you feeling in your body and also to describe it, because we have to help people reconnect with their emotions after trauma. Then we help to map that back on to what are they thinking that's making them feel that way? What are the scary thoughts that they are afraid are actually true about themselves? A lot of people have thoughts that are like, I'm bad. This happened to me because I did something wrong. What CPT helps people do is explore why they believe that about themselves so that you can actually process through that and release it. And the end result is that you feel differently about yourself, but not just about trauma. You feel differently about yourself regardless of where that came from. So I really like CPT because I find it to be extremely gentle in that way. One of the things that distinguishes cognitive processing therapy from something like EMDR is CPT has a lot more research behind it to prove that it works. There's over 50 randomized controlled trials showing that it works across many different populations. It's one of only two treatments that has follow-up studies showing that after you do the therapy, if somebody follows up with you even 10 years later, chances are you sustain your gains from that therapy. So that's something that really distinguishes it from EMDR, is that there's just a lot more research to show that it works. It's super important to choose therapies that are most likely to give you the best shot at recovery.